Good afternoon, everyone, and welcome to the Ajax Public Library's Cannabis Use in Older Adults Know the Facts, presented by the Baycrest Center. I'm Julia Campbell, and I'm the Adult Services Librarian at the Ajax Public Library. So I just wanted to cover a couple of housekeeping items. This afternoon's program is being recorded, so I would ask that you please keep yourself muted so that you are not heard in the recording and to minimize any distractions for today. And the chat button is there along the bottom if you have any questions or comments you would like to share. Please feel free to ask questions throughout the presentation, and our presenter Marilyn will either get to them during the presentation or at the end. And we also have closed captioning for our program today, so if you would like to turn on the captions, you can do so by clicking live transcript at the bottom of the Zoom screen and then show subtitles. And if you experience any technical difficulties, I recommend that you exit the Zoom and re-enter. And if you still have difficulties, please place a comment in the chat and I will do my best to assist you. So now it is my pleasure to introduce our presenter, Marilyn White-Campbell, a clinical geriatric addiction specialist with Baycrest Long-Term Care Behavioral Support outreach teams. She is the provincial lead for the Older Adult Substance Use Collaborative and has recently launched Cannabis in Older Adults Know the Facts. Marilyn is a co-investigator with Canadian Coalition for Seniors Mental Health Project, which established 4 national clinical best practice guidelines for SUDs in older adults, including alcohol, benzodiazepines, cannabis, and opiates, and is a co-chair for the Alcohol Working Group. She is the recipient of the Ontario Psycho-Geriatric Award of Excellence and the recipient of the inaugural Seniors Mental Health Outstanding Care and Integrative Practice Award from the Canadian Academy of Geriatric Psychiatry and the Canadian Coalition for Seniors Mental Health. With over 35 years of clinical experience working with older adults with SUDs, she is recognized as a pioneer in the field of geriatric addictions. And we are fortunate to have her with us this afternoon. So without further ado, I will turn it over to Marilyn to begin her presentation. Welcome, Marilyn.
Thank you, Julia, for inviting me, and thank you for those of you who are online. Feel free to jump in and ask questions. If I know I'm going to get to that later on, I will defer it, but I'm happy to take questions as we go along. So I'm going to just make a few disclosures that we did receive some funding from Health Canada for the National Best Practice Geriatric Addictions Project, and people did receive a small honorarium, and I received a grant for opiates in older adults, a spotlight on the opioid crisis, and then we also got a small micro grant to produce the Cannabis Older Adults Know the Facts, and that's from the Canada Health Substance Use branch with Government of Canada, and the views of the Cannabis Older Adult Know the Facts may not necessarily reflect what Health Canada has to say about it, but we did our best. So so this is the Cannabis and Older Adults Know the Facts booklet, which you can go website and download from the Behavioral Supports Ontario, and I want to talk about understanding the types of cannabis and the special considerations for older adults, looking at exploring current evidence for the risks and benefits of cannabis for older adults, and look at the implications for cannabis in persons living with dementia. So who uses cannabis more, youth or older adults? Maybe if you could just put your answers in the chat box or just pipe out, unmute your microphone and say what you think. Marianne says youth, and Julie, you think youth? And Joanne, same thing, youth. Well, isn't that surprising? The newest users of cannabis are actually older adults. They account for the largest number of new users since legalization. So people who used it in the 60s and now in later life are looking back and looking at their aches and pains and wanting to try it for a different number of reasons. So there's been a relative 57.8% relative increase for those age 65 and older. So you can see that older adults are the ones that are the highest new users. So, what's interesting from that is 6.9% of older cannabis users met the criteria for cannabis abuse or dependence. And lots of older adults think that there's, and the majority of the sample reported perceived no risk or a slight risk associated with monthly cannabis use or even weekly use. So people don't think that it's harmful. So the fact sheet that we developed was used to help older adults understand the risks and harms of using cannabis. So this is a graph that I did through the Canadian Centre for Substance Use and Specific Substances. So when you look at people aged 65 and older, in terms of what happens to them in emergency department visits per capita. What the people aged 65 and older, if you look at cannabis use, opiates use, and central nervous depressants, they're pretty much on the same wavelength, right? So the emergency department costs per person in Canada for people over age 65 is equal associated with people who use opiates. So opiate related, because older adults that go into hospital because of opiates, they stay on average about 28 days, a lot longer than younger people. So we're seeing older adults coming into the emergency department because of cannabis problems, with their cannabis problems. So there's lots of adverse events. There were 39,000 hospitalizations due to cannabis harms and 32,811 unique individuals. So some people went to the hospital more than once. And annual hospitalizations across the board due to cannabis harm has increased by 280% between 2003 and 2017. So it's across the board for all age groups and sexes as well. So you might have noticed these kinds of things that you see in the in the bookstores and magazine counters around CBD. This was put out by I think Boomer magazine, and it was called The Complete Guide to CBD. It says, sleep better, relieve anxiety, ease pain. What are the different things that you can use cannabis for? And they're even saying in here that cannabis can cure COVID-19. So be a good consumer. Make sure that you know what news is real and what's not real. There's no evidence whatsoever that it helps with cannabis helps with COVID. There's not evidence to around all these other claims. You have to think about what you're going to be using it for, and how and what form you're going to use it in. So there's 3 different types of forms, and their ingredients, they each work differently. So the first one is the THC has ingredients that give you the high or that euphoria. When it's smoked, vaped, or eaten, the cannabis with THC will reach the brain within 2 to 20 minutes, and it peaks within 4 to 6 hours in older adults. So the CBD portion is the cannabidiol, and the CBD doesn't have any of those psychoactive ingredients that THC does, ingredients that cause that high. So its ingredients will often make you feel calm, sleepy, relaxed. Although there's not much clinical evidence to support its use, CBD is commonly used for pain, inflammation, multiple sclerosis, seizures, difficulty sleeping. And when it's ingested, it'll take between 2 to 4 hours or longer in older adults before it takes effect. So the CBD contributes to the medicinal effects without the additional psychoactive properties. So we know that there's a variety of strains. The use of variety of strains on older adults experiencing any number of comorbidities, including addiction, depends on that ratio between the two primary cannabinoids to reach that desired effect and function. So remember that the CBD is the one that does not have psychoactive components in it, and the THC is the one that gets you high and has psychoactive components. Nabalone, that's the synthetic form of cannabis that can be obtained only by prescription for use for different types of conditions, primarily around agitation and mostly for people who it's being used in long-term care for people who have agitation. I'll talk about that later on. But it's really important that if you do have a prescription for nabalone or for cannabis, a medical prescription, that you not share your medication, your prescribed cannabis, or take anybody else's prescribed cannabis, because it's personalized, it's meant for that person. So here's a big question that we usually get is, has cannabis strength changed over the years? What dose should I use? So when in the 60s, when population, the boomers, so we're probably all boomers except Julia, but the THC levels in cannabis then were not the same as they are now. They're about 30 to 40% higher than they were in the 60s, and that's one of the reasons we're seeing people going to the emergency department, because people think, well, I used to smoke a doobie when I was a teenager, or I was in university and college. I smoked it and it was not a problem, but it was a cleaner type of cannabis then. It didn't have all the toxins and chemicals on it that we see today. And the THC content is like off the roof. So you can get as high as 30% THC content. So unless you know, when you go to purchase your cannabis, unless you know what your THC dose is or your CBD dose strength is, that's where you will notice the difference in the side effects. So you've got a greater chance of having side effects that are much more intense. So if you plan to use cannabis, you really need to be aware of the amount of THC you've got in it, and start at the lowest possible dose and slowly increase the dose until the desired effect is reached. If you're not sure where to begin, ask your doctor or your pharmacist, or you get your doctor to review the Canadian guidelines for cannabis use in older adults with you. So we know that cannabis use disorder can become problematic. So you develop a cannabis use disorder. People say, "Oh, it's a natural product. I can't get addicted to it." Recommendations from the Canadian Coalition for Seniors Mental Health recommend that cannabis should generally be avoided by older adults who have a history or are currently experiencing mental health problems, problematic substance use, or a substance use disorder. And the other instance where you absolutely shouldn't be using it is if there's cognitive impairment, cardiovascular disease, cardiac arrhythmias, coronary artery disease, unstable blood pressure, or impaired balance. Why is that? So, these are some of the contraindications, the problems that older adults have. If you add a drug on top of all these other conditions, you can run into some problems. So what are the risks? So anybody who's considering using cannabis, should speak to their doctor or their pharmacist and look at what are the side effects, what are the risks and the side effects. There's lots of studies that have proven that the risk of the following conditions, there's risks from a number of conditions and experiences when you're using cannabis. So it can cause an increase in your heart rate. It can cause impaired coordination and impaired reaction time. It increases the risk of falls. It can cause impairment in memory and attention. certainly causes drowsiness. The CBD causes drowsiness. There are cardiovascular risks and even a risk of stroke. And the interesting bit of information I got from the addiction medicine physicians is that when they were, there was a doctor that I met who had been to in Colorado, and they said they saw in the young population after cannabis became legal in Colorado, was that young people that were using the oils were stroking out at 14 and 15 years old. So imagine what that would do to an older adult. So the risk for stroke is increased if you use cannabis. So it can worsen liver disease, and there is a risk for unintentional poisoning. It can cause nervousness, feeling suspicious. That's that psychoactive component, the THC, so the smoked weed, feeling suspicious, some disturbed thinking, panic attacks, and can lead to mental illness. It is positively associated in youth with first episode psychosis. Again, so if you already have some mental health issues on board and you add something that's going to make it worse, that's why people need to be aware of the risks of using cannabis. So it can worsen a psychotic disorder or schizophrenia. It can worsen breathing problems, including the increased risks for developing long-term health problems such as chronic bronchitis and shortness of breath. So we know that there are certain people who should completely avoid non-medical use of cannabis to get high. And caution should be exercised in making cannabis available to older adults that have cardiovascular disease, so arrhythmias, atherosclerosis, blood pressure problems, any osteoporosis, impairment of memory, or any balance problems, histories of other substance use disorders with alcohol or other central system drugs. So if you have a problem in managing with alcohol, if there's a substance use disorder related to alcohol, benzodiazepines, opiates, it puts you at higher risk of becoming addicted to cannabis if you start. And older patients with positive family histories of psychosis, major depression, bipolar disorder should probably also not use cannabis, either therapeutically or recreationally. There's lots of discussion out in the community. People say, well, I take it to help me relax because I get anxious. Well, it actually makes those conditions, depression, psychosis, and bipolar disorder, much worse. There was a study that was done at CAMH with young people, again, not with older adults. It's really hard to recruit older adults where they might have some adverse events. But what they did was they said to people, we'll give you $350 if you stop smoking cannabis for a period of 3 months. We don't expect you to stay stopped, but we want you to try it for 3 months. And if you don't stay stopped over these 3 months, then we won't give you the money. So that was the deal. What happened? The people with depression, anxiety, and bipolar disorder, their depression and anxiety improved quite dramatically compared to those who did not stop. So there's some evidence to suggest that it really does interfere with depression, anxiety, and bipolar. So we know that it's difficult to generalize for older adults who are likely to be using for purposes of chronic pain, anxiety, and other central conditions, but that overlaps significantly with the contraindications. So you have to weigh the pros and cons. On the risks and benefits. So the index that the Canadian Coalition for Seniors Mental Health set was they needed to set the point where the caution is ought to be exercised. So erring on the side of caution. So here's some of the psychoactive symptoms that you may see, the physical and psychological. So the person may have a pronounced body sway, eyelid and body tremors, slow and deliberate speech, dilated pupils, watery red eyes, increased blood pressure. That's for new users, so people who are not used to using cannabis, and an increased pulse rate. So again, if you've got cardiovascular issues already, it's something that may worsen the condition. In terms of psychophysical inhibitions, you might think you're funny or a sharpened sense of humor. There may be difficulty concentrating, disorientation, short-term memory problems, fatigue, lethargic, altered time and space perception. And the thing is that, in terms of cognition, it can happen for older adults that it does affect your memory. The good news part of that is that it can be reversed if you stop. So we know that the THC level in the blood or the saliva is not indicative of what's in the brain. So if you had to do a test, a saliva test or a blood test, it doesn't tell the doctor how much of the THC is in the brain. Cannabis is soluble in fat, and the brain is all fat, and so it goes to the brain first. That's why it has, that takes effect. It affects our ability, our motor skills, everything to do with the brain. So what are the risks of using cannabis? So increased heart rate, impaired memory, attention, cardiovascular risks, and so on. So what about with older adults? I mean, if you've got memory issues and you're taking cannabis to relax, and you've noticed, memory is not that great, then you're adding this on top of it, adding a drug on top. So, when you ask somebody, if you have a family member who has dementia already and you're asking them to make some changes, think about this, that you're asking them to change, but they can't remember what they're supposed to change from. So the other thing is that cannabis can be the result of, or you can end up with poisoning. Again, people think it's a natural product. It's a normal thing that grows in the fields, that grows naturally, but it can cause poisoning. Under what circumstances? This is a study that happened, I can't remember where it is, in Norway or Belgium. I can't see the small print there, but this is just an example of a paper that was written up in Europe. It was a group of people who attended a cooking class, and what they did in that cooking class was they made edibles, and so they handled it. They didn't have gloves on, they didn't have masks on. They handled the cannabis, made the products. They made some gummies, the cookies and brownies, and so on. And then after they'd finished making them, they could also consume the product. So what happened? So of the number of people that attended the class, there were two elderly people that attended the class. One was about in their 70s, and one was in their 80s, early 80s. And those two people, everybody, just to be clear, everybody who was in that cooking class ended up in the emergency department, toxic with cannabis. The two people who fared worse were the older adults, and both of them ended up being admitted to ICU. They were fined the next day or 2 days. They were able to be released, but they ended up in intensive care unit because of toxicity from cannabis. So it's really important to be aware what you're taking and how it's being consumed. So how long should I wait after using to drive after using cannabis? So 1 to 2 hours, 2 to 4 hours, 6 to 8 hours, 24 hours. And the other one is I'm a better driver. So it doesn't play to me. What do you think? How long? Okay, 24. Ding, ding, ding. That's correct. So 24 hours. So in fact, as we age, metabolism slows down by as much as 50%. it means not only will it take longer for the cannabis to take effect, but also it takes longer for your body to eliminate it. So if you vape or consume cannabis, it'll be in your system for at least 25 hours. And so it's recommended that you not drive for at least 24 hours after using cannabis. And that's the recommendation in the Canadian Coalition for Seniors Mental Health guidelines for physicians to make recommendations. So, and certainly there's risks, and your risk of having an accident increases from 22 to 36% after consuming cannabis. And certainly the rules around using cannabis and driving is the same as it is for alcohol. So THC has its peak concentration within several minutes. It's 20% of it, it's in your blood. But as I said earlier, it's soluble, and the cannabis goes to the brain very, very quickly. It's stored in that fat tissue, and there's residual impairment even the next day. 2 months after quitting cannabis, it is still detectable in your system. So, and the highest concentration is in the first 2 to 4 hours of consuming cannabis. So if you smoke it, if you ingest it, then it takes a bit of time to get into your system. But it also depends on how often you smoke it. If you're a regular smoker, and it can be higher in your blood level, it can stay in your blood for 4 to 6 hours. And also, again, how concentrated is the joint? What's the THC level of it? It's 5 times more concentrated than in the past. And think about it, if you're using a wheelchair or you're driving a car, it's all the same thing. You really need to be cautious about being in a motorized vehicle. The percentage of fatalities involving cannabis have increased from 9% in 2000 to 21.5%. Again, fatalities in 2018. And so, we know that car crash deaths involving cannabis are on the rise in the US. So we know that in Canada, we're going to be seeing, and we are seeing the same trends. So around alcohol impaired driving, the Mothers Against Drunk Driving campaign is out there. It's on the news all the time. They have campaigns, but we're not seeing the same level of public awareness that we do for people around cannabis. So edibles, I want to talk about edibles. Those are foods that contain cannabis. Is it safer to consume than smoked cannabis? Well, the answer in the short is no. While it seems that it would be a safer option, the research indicates that eating these foods that contain cannabis carries more risk. So if you look, here's some pictures of different types of cannabis that you can buy from the Ontario Cannabis Store. And the thing is, there's different levels of THC. There's 10 milligrams in the first one. And the second one, the Wild Berry Blaze Soft Chews, that's 10% THC and 40% CBD. And these ones, 10%. So you really have to be careful. And the reason for that we need to be mindful when we take edibles is that when you eat those things, whether it's a brownie, a gummy bear, or a cookie, you might not feel those effects right away. It can take up to 2 hours to feel those effects. And some people say, well, gee whiz, I had a little bite of this cookie. You see down in the bottom here, that's a cookie that you get from the Compassion store, and you're not meant to eat the whole cookie. You may only want to start with, especially if you're a new user, a novel user, you might only want to take an eighth of that cookie. Just try it, see how you're taking more cannabis than they intend to. And that can result in an overdose, because you can always stop smoking the weed, the cannabis smoked form. But once you've ingested something, you can't get rid of it. It has to go through your body, and you have to eliminate it through your liver and kidneys. So it's really important to start with a small amount of the edible and wait to see how you feel. So, so if you have 1/4 of a cookie or 1/8 of a cookie, then wait for 2 hours, and then if you're not feeling the effects of it, then have another portion of it, but small pieces. You might also have a poor reaction, so it's really best to go slow because you can't undo that once it's been ingested. So, and also, again, the caution not to share with others. The other thing is that for older adults as well, edibles can be a risky, people, you're seeing more and more in the news around edibles that grandparents or parents have. They're using it for pain or whatever conditions, and they leave house and the kids get into them, or the grandkids. Some side here, this one says Stoner Patch Dummies, right? And over here we have Maynard Sour Patch Kids. So very similar packaging and marketing. So how do the kids know the difference? So it's really important to keep your products under lock and key, so that kids can't get into it, or even pets. So here's the difference between smoked cannabis and eaten cannabis. So if you smoke cannabis within this on the bottom line, this is the duration. So that's 200 to 60 minutes, 120 minutes, 180 to 240. So you smoke it, you get a little bit of a high, and then you start to come down. Right? When you take an edible, you eat it, and you don't start to feel the high until 60 minutes or 120 minutes in. And then it's a slow taper down. So it doesn't start to go down significantly until you reach the 240 to 360 minutes. So again, once you've ingested it, you cannot undo that. It's important that you not drive for at least 24 hours after you've eaten cannabis. The same goes if you smoke it. So you might want to plan for a ride home, or have a designated driver, take a taxi. And edibles and all other forms of treat or candies and edibles are toxic to both children and pets. There have been a number of times when we see in the news that children have been admitted to intensive care units because they've eaten the parents' cannabis. Here's a really popular thing that we hear about: is that my friend says the cannabis helped her with her knee pain. Should I try it? There's really no conclusive evidence to suggest that cannabis is helpful for the treatment of pain, but there's lots of anecdotal evidence. There's some organizations, for instance, Multiple Sclerosis Society of Canada, that endorse the use of nabilone, and that's the synthetic form of cannabis for pain. But overall, there is not a whole lot of evidence to suggest it. It's more anecdotal. And I want to also say that if you hear that there's some research out there, look at that research with a very, with a magnifying glass, because who was the author of the research? There was a research project that was on the CTV News a couple of years ago, 2 or 3 years ago, and they were saying, cannabis helps with seizures. Look at this. We had a study in Israel, and there were 230 participants, and it helped all with seizure disorders. Well, who was the author of that study? It was a cannabis company. So will cannabis help with some of the anxiety and depression that I've been experiencing? And again, not a lot of conclusive evidence to suggest that it's helpful for the treatment of anxiety or depression. In fact, the opposite may be true. Cannabis can worsen an individual's depression and anxiety due to those mood-altering ingredients of THC. So the tetrahydrocannabinol can cause, trigger, or worsen a psychosis. So if you have an existing depression, this is not going to help you with depression or anxiety. So, and this one is an interesting one, which has received, again, a little bit of attention in the news. I've heard that using cannabis can help manage behavioral symptoms of people with dementia. Is that true? According to the Alzheimer's, cannabis to be helpful in managing behavioral symptoms with people with dementia, including agitation, and physical and responsive behaviors and expressions, but only in some cases. In fact, some studies have shown that long-term cannabis use may be harmful and is associated with cognitive difficulties. There is a study by over at Sunnybrook that showed some promising evidence, promising evidence. But some of the studies that you'll see out there, we're looking at, is cannabis helpful in managing behaviors? Well, the reality is that many of the people that were in these studies were already on benzodiazepines. And so it kind of clouds the evidence to say, did it work or did it not work? Was it the benzodiazepines or was it the cannabis, or was it the combination of cannabis benzodiazepine? So you have to be very, be an investigative reporter, so to speak, when you're looking at these studies. But with a standalone study, if you're just using nabilone and CBD, like the synthetic nabilone, there has been some small number of studies to suggest that that nabilone helps with agitation in older adults with Alzheimer's disease. Again, very small but promising study. So do we use cannabis for sleeping? Will cannabis help with that? So CBD may have a sedating effect. If you choose to try it again, the cannabidiol or the CBD to aid your sleep, again, you want to make sure that you have somebody close by if you need to get up in the middle of the night, because the risk of falls is heightened with use. Now, remember adverse events of people who've got high blood pressure, cardiac issues in the first place. So if you have cannabis and you wake up in the middle of the night and you have to go to the washroom, it may not be the cannabis that causes you harm, but it may cause you to have a blood pressure drop. You might fall and then break your hip. And so it's the consequences of the fall that can be life altering. So again, so CBD, if you're going to try it, then be very cautious and make sure you've got somebody there to make sure that you're safe if you need to get up in the middle of the night. So what are the signs of overdose? That if taken too much cannabis. So individuals can consume too much cannabis will awful, nervous, having visions or hallucinations, and they may feel nauseous and have vomiting that won't stop. And that's particularly worrisome in an older adult. If you are vomiting and it won't stop, older adults can decompensate very, very quickly, because you can become acutely confused if you can't keep anything down. So it's very, very worrisome. And if you've got any of these symptoms, you need to go to your doctor or go to the nearest emergency department, because what you're experiencing is what's called hyperemesis. So it's is a side effect of cannabis toxicity, and it needs to be treated. And the other thing is to be aware of is that different forms of cannabis may impact you differently and can react with other medications you're taking. So it's not a great idea to sorry, I've got something on my screen I don't want to. Can you see that, Julia?
No, I can't see anything.
Okay, it's interfering with my slides, though. I can't get rid of it. There we go. Okay. So it's just my phone. Anyway, so people who have cannabis and are using other medications or alcohol, they're all drugs. Alcohol is a drug. Alcohol is a depressant. So, mixing cannabis with alcohol and your blood pressure medication, it's an accident waiting to happen. And remember what I did say that earlier is around cognition, is that it can cause memory problems. And I'll give you an example of somebody a colleague of mine, who went on a vacation, but before she went on vacation, she had this dear old dog, and his name was Charlie, and Charlie was a big old Labrador Retriever, and Charlie had arthritis, and it was getting, he was an older dog, and he was having trouble getting up the stairs, and so she decided to get some CBD oil for the dog. Got it at the at the pet store, and she gave Charlie the CBD, and pretty soon Charlie was not only going up the stairs, but he was jumping up on the bed and feeling just great. And so they thought, wow, what a big turnaround that Charlie had. So if it was good for Charlie, maybe it must be good for me. So when she went on her vacation, she took some of that, and found that it was very helpful for her. She was able to do everything that she wanted to do on her trip. She was able to do long walks and tours and so on, and she had a great time. But when she got back from her trip, she found that she needed to be really on top of things, and she found that it affected her memory so bad that she was not remembering really important things, and so she stopped taking it, and within about a month, she said that her memory returned to sort of her baseline. So, and this is somebody really, highly educated person, and she was able to recognize that it really, the risks, and the risks and the pros and the cons of taking cannabis. There were more risks for taking cannabis than benefit. So take that into consideration and ask yourself the question: is the cannabis doing more to me than for me? And again, start low and go slow. So we've written up some safety tips in these booklets. We've got keeping the cannabis in a locked box or a container. Again, nothing that you can see in a clear jar or anything like that, especially for edibles, so that other people can't get in. It's just like all prescription medications. If you're prescribed cannabis, don't store your edibles in see-through containers so that others can see the contents, and keep it out of the reach of view from others and in children, and certainly pets. So don't ever leave it lying around, because pets can get into it as well. So realize that different forms of cannabis can impact you differently. And can react with medication that you're taking. So don't mix it with cannabis and other medications or alcohol. CBD can make you drowsy, which may increase your risk for falls. And take precautions. Make sure you've got somebody with you when you're consuming cannabis. So never drive high. Sorry, I've made a mistake on the slide here. Never, don't drive for at least 24 hours after using cannabis. So I've got some resources here for you. There's, again, if you wanted to point your doctor in the direction, if you're having a discussion with your doctor about how cannabis might be a benefit to you, there's a document available through the Canadian Coalition for Seniors Mental Health, and there's cannabis guidelines, and there's also there's a handout for older adults and for family members and caregivers, and then there's also ones for primary care, your physicians. This other document, and I'll put my camera on so you can see this. This is the one that you can download from the Brain Exchange website. It's called Cannabis and Older Adults Know the Facts. It's available for download, and it's about, I think, 8 pages. And it covers a lot of the things that we talked about in here. So, and this is evidence-based as well. This is not sponsored by the drug companies from, the cannabis companies. This is sponsored by Health Canada. And was evidence-based. There's also a booklet out by Active Aging Canada, and you can go to their website, and I think that they've run out of copies of it, but it can be, they're going to get a reprint of it. You can get them to send you a copy of this. It's not as evidence-based as the fact sheet, but it does have some really good pointers in here on the very, on page 37, there's a nice little document in there on that you can take to your doctor. So showing what your personal use is like. So it talks about what your symptoms were before you used it and symptoms after use and how long it lasted, etc. So it's a good idea to keep a diary. And again, having some discussions with your doctors around that. So there's also, different ways to reduce your risks, and clearing the air about cannabis use from the Ontario Medical Association. And there's a medical guide from the Arthritis Society and one from the Government of Canada on cannabis and your health. So lots of good resources out there, and there's more and more research that's coming out that we know of that, again, a little bit more evidence-based. The evidence, the research is changing all the time. Before cannabis legalization, it was very difficult to do cannabis research on any subjects, and so now there's more evidence out there on the risks and benefits. So it's important to be, a cautious consumer if you're considering trying it. So now we've got about 12 minutes left. If we've got any questions, I'm going to put it on gallery view.
Thank you so much, Marilyn. I'm just going to stop the recording and then open it up to the group for questions.